My name is Ben Carpenter, and I will be talking to you today about traumatic brain injury, or TBI. Most of you have probably heard of traumatic brain injury, and some of you might even know someone who suffers from a traumatic brain injury. But do you know what suffering from a TBI really consists of? Or how to effectively work with someone that has suffered from a TBI? After this video, you will know exactly what a traumatic brain injury is, the characteristics of a TBI, special considerations and activities when working with someone with a TBI, and some tips to use when communicating with these individuals. What is a traumatic brain injury? According to the CDC, a traumatic brain injury is an interruption in normal brain functioning that is caused by a violent bump, blow, or jolt to the head or body, or by a piercing head injury. However, not every bump, blow, or jolt to the head or body will necessarily lead to a TBI. In milder cases, the effects of a TBI may be less severe and only temporary. In the more severe cases, the effects of a TBI will be significant and will be long-term. They could possibly last the lifetime of the individual or even result in their death. This is due to the bruising, bleeding, torn tissue, and any other physical damage that might possibly occur to the brain during the trauma. At this time, we will complete Activity 1. Please pause the presentation, click on the link below to watch the clip, and then answer the following questions. We will now discuss the facts and stats associated with TBIs. Every year, about 300,000 teens suffer concussions or mild traumatic brain injuries during high school sports. From this number, the majority of the injuries come from female soccer players. Every day, about 153 people die due to injuries associated with TBI. The most common cause of TBIs are falls, and falls accounted for 54% of traumatic brain injuries for children between the ages of newborn and 14, and it accounted for 79% of TBI injuries for elderly people 65 and older as of 2013. In 2012, approximately 329,290 kids under the age of 19 received medical treatment for concussions and TBIs in emergency rooms due to recreational and sport activities. Males are more likely than females to suffer from a TBI, especially in the teen years. From September 2001 to August 2014, about 300,707 service members have suffered from some type of TBI. The cognitive characteristics of a TBI include shortened attention span, memory problems, poor judgment, partial or complete loss of reading and writing skills, problem-solving difficulties, language problems, which will include communication deficits and a loss of vocabulary, the inability to understand abstract ideas, difficulty learning new things, a difficulty retrieving old information, difficulty remembering facts, procedures, and events. They will also be slower to respond, react, and complete activities and tasks. And they will have difficulty sequencing events. The physical characteristics of a TBI include weakness, muscle coordination problems, paralysis, which can either be full or partial, changes in the senses, which includes everything with sight, hearing, smell, taste. They could have seizures, which they are known as traumatic epilepsy. They could have sleep problems, which would include difficulty staying awake, and they could also have speech problems. The behavioral characteristics associated with TBI include difficulty with social skills, which this can include inappropriate social behaviors, a lack of empathy, a tendency to be self-centered, unable to control emotions, and this can include emotional responses that may be unpredictable in nature and severity. They'll have difficulty regulating their emotions, and emotional responses might not fit the situation, or they will have an emotional instability where they could be happy at 1 second and then sad the next. Um, this would also include irritability, frustration, inappropriate and aggressive behavior, extreme mood swings, and it could also include depression. There are some special considerations that you will want to take into account when doing activities with someone that has suffered from a TBI. You'll want to use low lighting for light sensitivity. You will need to eliminate loud music or loud noises for sound sensitivity. You'll want to limit outside distractions, use small group activities, allow for frequent breaks, make sure you are repeating your instructions. You'll want to allow more practice time and more response time when answering questions. You'll want to have no impact activities. You'll need to break longer activity sequences down into smaller steps because they have trouble sequencing long activities. You'll need to have students close to you during instructions so that they don't have to worry about trying to limit the outside distractions on their own, and that they can clearly hear you and hear your instructions. You want to provide low pressure situations where you're not putting the student on the spot by having them get up and demonstrate a skill that they might not necessarily know how to do, or something that they might have trouble completing. Some communication tips for people with TBI include if you're, say you're out in a public area or somewhere that has a lot of distractions, you'll want to think about maybe moving them to a quieter location, so you can better help their concentration. They don't have the outside distractions taking away from what's being said between you and them. You need to be ready to repeat what you say, whether it's out loud or in writing, because some people with TBI have short-term memory deficits, and it makes it hard for them to understand what you're saying and what needs to be completed. If you're not sure whether a person with TBI understands you or not, you want to offer assistance in helping them complete the task. But with that, you want to make sure that you wait for them to accept your offer of assistance and don't just automatically assume they want you to assist them, because it can, over assisting can be patronizing to them. You'll want to allow extra time for them to make decisions, and you want to be patient and flexible and supportive, and take the time to understand them and who they are, and make sure that they understand you in order to avoid any kind of miscommunication. And you also want to avoid interrupting the person while they're speaking, or trying to finish their sentences, or things like that, since they might take more time to convey what they're trying to say to you. It is now time for activity 2. So if you would please pause the presentation And then you will read the scenario that is listed here for activity 2, and then you will answer the question that goes along with it. In closing, a traumatic brain injury is a serious issue that results in problems with learning in many different ways. Due to the fact that the injury involves the brain, people that suffer from TBIs can be affected physically, mentally, and/or emotionally. Also, since these problems can't always be seen and are rather internalized issues, it can be especially frustrating when working with someone that has suffered from a TBI, not only for you, but for the person with the TBI as well, which makes it even more imperative to know how to work with these individuals. So, it is important to remember to be patient and understanding when working with these individuals and to be flexible in your interactions, because no two traumatic brain injuries are the same in terms of symptoms or treatment plans. I hope you all are able to take the knowledge from this presentation and apply it successfully when dealing with someone that has suffered from a traumatic brain injury. Thank you.